Okay, so you have concert tickets to your favorite performer, and then at the 11th hour, they cancel the show, and you find out later it's because they've got vocal damage. What is this caused by? Where did it come from? And we toss around this term a lot, but there's actually different types of vocal damage that can exist. So let's talk about a few of them. One of the most common forms of vocal damage are nodules or nodes, as they're called. And those are calluses on the inside edges of the vocal cords that basically create a type of inflammation on the cord that hinders the ability of those vocal cords to seal properly. And as a result, too much air texture typically comes through there. So a lot of times if somebody has vocal nodes, then they are probably going to push harder and harder in order to create a clean sound because those inner edges don't seal up cleanly. So in order to have power, they're recruiting more and more muscle density. And a lot of times if somebody that you know or you yourself have nodes, you'll find that there's that temptation to push harder just in order to make any sound come out whatsoever. Polyps are another type of vocal damage. Polyps are like a growth, a benign growth on the vocal cord that are typically bigger than nodes. They're easier to spot on a vocal scope, and they are more usually an acute response of the body to some kind of trauma or extreme yelling. Like sometimes people, for instance, with polyps, somebody is going to develop a polyp sometimes after going to a loud football game and screaming really, really loud, and then they might end up with a polyp. Not saying that they will, but that's how they can happen after an event. Whereas nodes typically form over the course of time. Similar to how you get calluses on your fingers after a long time of playing the guitar, you can develop nodes, calluses on the vocal cords through a long time of misuse of the voice. Then you have cysts. Cysts are pus-filled sacs that grow on the vocal cords as well. And then you have things like muscle tension dysphonia, or MTD as it is abbreviated to. And MTD can be typically brought on by stress factors in life. A lot of people that I've worked with MTD had maybe a trauma event happen. I actually had a client one time who was a professional baseball player and was hit in the throat with a baseball pitch going at, 80, 90 miles an hour. And he got hit in the throat, and he lost his voice for a very long time. And when it came back with MTD. And there's just a lot of trauma wrapped around that. And the voice has a very hard time, neurologically speaking, even to relax and let go. It takes a lot of vocal therapy sometimes to work through those types of issues when it comes to strain and stress on the voice. You've maybe heard of somebody also having a vocal hemorrhage. And what that is a type of bruising on the vocal cords that's actually an internal bleeding inside of the muscle of the cords. It's not bleeding externally that would scab up, for instance, but it's on the inside. And this can cause a lot of problems as well. Now, almost all of these issues can be overcome by proper use of the voice, by learning right techniques. Very rarely does somebody need surgery in order to work through some of these things, but it does happen. You always want to err on the side of being super conservative to try to avoid surgery as your course of action, because the reality is you could have surgery to maybe remove something that maybe you could have dealt with without surgery. But if you don't know how to actually use your voice properly moving forward, you will end up in the same position again. So it's vital that you learn how to use your voice the right way so that you don't repeat history with yourself. All vocal damage is basically resulting in inflammation. And that inflammation is going to prevent an easy, clean sound from coming out of your voice. And it's typically going to result in more straining, more pushing, hoarseness, a propensity to crack and break more often, extreme fatigue, lack of endurance, lack of power, all of those kinds of things. Those are common symptoms of vocal damage. And if you suspect that perhaps you might have something going on besides maybe singing too loud at a concert for a day or two, or maybe some allergy issues that are flaring up, then go see an ENT. Go get your cords scoped and see what you're dealing with. It's always good to know and be empowered with that kind of information, and then bring that to your coach so that they can help work through those damage issues with really, really effective vocal therapy and get you where you need to be.